Hello and welcome to the student series with AMSC, where we invite people from all walks of medicine to give their advice on career to the people who are still students. So to start off with, I'm going to talk a little bit about 10 things I wish I knew as a medical student now that I'm a resident and I've been working for 1 year in the hospital. Just some tips that, I really feel like would have benefited myself back when I was in the early years of med school. So to get right into it, number one is to find your study style. Now, if you're anyone who is similar to me, I am, a bit of a procrastinator and tend to leave things until the last minute. So, which was fine kind of, I think, up to med school, but after you get to a certain stage, knowledge is really kind of complex and there's so much to learn that it's quite impossible to cram in the night before an exam. So therefore, it's really important to find your study style. And some of the things that really helped me included finding past questions so that you know exactly what the high yield topics are for each exam. Using flashcards so you can have the kind of spaced repetition tactic that you can use, which I'll talk a little bit about later. Another thing is having a study group. So for me, a small study group worked well where we had 2 or 3 people and we would find a dedicated time where we would study and teach each other. And in that process where we say things out loud and discuss things, it's kind of actively engaging our brains rather than passively reading from a textbook or notes. And once again, spaced repetition, so making sure that every few days you're revisiting the same information so that you don't kind of get to one round of study and finish it, then kind of realize that you haven't taken anything in. Another thing I liked was having kind of spatial memory. So I know people have different kind of opinions on writing notes, but for me, it helped when I wrote down notes and I knew exactly where a piece of information was, and that helped me associate the knowledge with a particular space. And I would stick my notes on the walls and I would remember, okay, so that was a note on that wall, and then it would help me recall the information written in it. Another thing I really liked was the Pomodoro timer. I don't know if I'm pronouncing that right, but there's a few apps on your phone that you can use. And basically it's this idea that you study for a 25-minute block of time, and then you have 5 minutes rest, and then you do 25 minutes and then 5 minutes rest. And after a few, you get a bit of a longer break. It's something that I guess would benefit me when I was studying for an exam where I knew I had to sit down for a long period of time, but just kind of knowing that after 25 minutes, I can have a break is really motivating for you to kind of stick to it instead of getting distracted. Then my number 2, actually, before I go on to that, is to try and form good habits. I really like this video with the TED Talk about the inside the mind of a master procrastinator. I think it's a really good insight into why we procrastinate. But in saying that, watching it hasn't really stopped me from procrastinating, I have to say. There's this YouTuber that I quite like who I think graduated from Cambridge, and he's working now in the UK as a doctor. He makes these quite good videos about productivity and studying methods, and I find it quite helpful. And he's just one of those people who, you can see that he definitely just gets things done, and it's quite inspiring to watch his videos. Then on to number 2, which I think is something I really wish I knew starting off in medicine, is that the medical curriculum in university is not always structured in the most logical way that you can learn. And sometimes the online resources out there are actually better in terms of organizing the knowledge. So my favorite YouTube channels are shown here, and they're very good for kind of accumulating the knowledge. So the first one, Armando, he does these brilliant drawings of especially like physiology, pharmacology drawings, where he summarizes knowledge and in a very easily understandable way. So I really wish I started learning from them quite early on. Obviously, identify what you're learning in your medical school curriculum. Then you can search up their videos to learn from them. Then you also want to have some evidence-based websites for referencing and for fact checking. And also if you just want to quickly look up some information on this particular condition, say when you're on the wards, those are really helpful, which are on my next slide. And also flashcard apps for spaced repetition, such as Anki. You can make your own decks, or you can search online. A lot of people put their decks up there for everyone to use. And in terms of buying textbooks, honestly, the only textbook you really need is Tally and O'Connor's clinical examination. Everything else, I think the textbooks go into too much detail, and you don't really need to have a physical textbook because most of your libraries will have online copies anyway. So I didn't believe that when someone told me when I was in first year medicine, but at the end of it, I can confidently say you only need Tally and just don't buy any other textbooks. So more of my favorite online resources. AMBOSS is a really good website to kind of look up the information about a particular condition, including the kind of epidemiology, including the presentation that it usually has, as well as a bit of management detailed, and it's evidence-based. It's really good. It does cost money, but often you can, if you have enough people in your med school cohort who are interested, you can definitely get a discount when you buy together. And they have some question banks as well if you like to do those to study. Geeky Medic's really good for clinical examination skills. They make videos, as well as they have the kind of a checklist of to-dos on their website in web pages. Life in the Fast Lane, very good for ED stuff to look up and reference things, and they have a good ECG library that you can learn from as well. Then KenHub and Teach Me Anatomy are both sites that I would use for anatomy learning. Quite good for a quick reference, as well as systemic learning. And then on the right side, obviously you have these BMJ best practice, up to date, and ETG for your kind of more official resources that you can use for like assignments and also for reference. Like in my day-to-day work, I would often use ETG to look up drug doses and, you know, the first line, second line of antibiotics and things like that. So definitely familiarize yourself with those resources because they can be very helpful. The number 3 is about clinical skills, and my advice is just practice. Use Tallies as a textbook, use Geeky Medics, and just rehearse it like a dance. Like in my first years, often I'd be doing things, but not really understanding the why of doing things. But sometimes you just have to kind of fake it till you make it. It's about the spiral learning. You initially just kind of do things, but then eventually it'll click. And even though at first you might not really be picking up what you're supposed to hear, but you know, if you listen to enough lungs, you'll eventually hear what you're meant to hear. So just keep practicing, practice on each other, do the full thing, kind of don't just do a bridged version of it, actually fully expose and do like each step properly. And after a while, it'll be kind of second nature, especially things like neuro exams where there's a lot of steps. It's just really about doing it enough times. Like no one is good at it the first go, but you know, if you're doing it 50 times, then you probably will be quite fluent in it. In terms of your history taking, use the acronyms, but also kind of find your own flow. And once again, when you have enough practice, these things, even if you don't stick to the particular Socrates pain history, you'll still know kind of what you're missing in your history and what you still want to know. And of course, if you're early on in your med school degree, always ask for consent and always wash your hands, and then you'll pretty much pass your clinical skills station already. Then number 4 is make the most of your time on the wards. I'm quite guilty of saying I have class at 11 and then kind of never coming back to the wards when I was a med student. But I think as an intern and resident, you can definitely tell when kind of new interns come in who's been on the wards, who knows how to do things and who hasn't. And when you're on the wards as well, I think it can be quite boring if you're not participating in anything, but you know, offer to take notes, do small things, and actively think about how the patient is being managed while you're there. And ask all the questions you can. Honestly, everyone loves a keen med student, and no one will judge you for asking silly questions because we've all been there. And also practice the procedures wherever you can. Just, I think it's best to say up front, like say if you have like a team you're attached to and you have an intern or resident or even registrar, say, hey, I'm keen to do these IVCs, let me know if there's any. And also you can ask the nursing staff because they're the ones who usually put in NG tubes and IDCs. So definitely like say up front that you're keen, and then people will think of you when they have something that you can do. Again, make friends with nurses and allied health staff, physios, pharmacists, they're great teachers and they can teach you a whole lot. If you're a super keen student, you can collect a little logbook of your patients. This is a really good way to learn where you have a case and then you kind of go back and look up information around it. Then it's really easy to remember. And also it's good if your university has kind of this learning criteria of self-directed learning. I went to UNSW, so that was one of our graduate capabilities. And it's quite good if you have this logbook to show, hey, I've been there, I was engaged, and these are the things I learned. And it is valuable for your own learning as well. Number 5 is to think about where you want to take your career and think about this early. As you can see, I've included a very helpful diagram for how to decide what you want to do when you become a real doctor. But I guess what I would have wanted to say to my med school self would be that to think about it early, and not just think about it, but also actively ask people in the specialties that I'm semi-interested in to just say, hey, look, I'm interested in getting to know more about your specialty. Can you tell me about, what's your typical week like? What do you do? Because the day-to-day work might be quite different from the things you learn in med school. For example, say in neurology, you might learn a lot about all these weird and wonderful neurological signs, but a typical day of a neurologist who's an inpatient neurologist might be a lot of stroke calls, and an outpatient neurologist, in the clinics, they would see also then completely different pathologies. So ask people what their work is like, ask people what it's like to train in their specialties, and there's a lot of things to consider, not just the clinical interest side of things, although that is really important to kind of keep you going. Also think about, what do you want your lifestyle to be like? Do you have other things that you also want to do on the side? And kind of start thinking and also start asking people questions. And don't be afraid to kind of jump into something, because as a med student, you can, explore something, and then if you don't find out you don't like it, then you have time to change, rather than kind of not trying anything and then at the end of it not knowing what you want to do. So that was me for a long time. I was scared of committing myself to a specialty, but I think it's perfectly fine to, as a student, especially when you have the time to explore different careers, and get started on some of kind of the research and the studying around that specialty, because specialty training is quite competitive. And when you're a student, you have the time, even though it might not feel like it, but you really do have a lot more time than when you start working, because your job is just to study. And also people love keen medical students much more than they like kind of keen doctors, because you're kind of more, I guess, of a little baby, and they want to like teach you and help you. So make the most of that period of your life. And then number 6 is do some research, and learn to do stats. So as you can see, this is a little lovely diagram I found on the internet. And nowadays a lot of specialty training areas look quite favorably on publishing papers in journals or even posters at conferences. So definitely, if you have the chance, you should create the chance for yourself to do some research as a med student, and a lot of universities will integrate that with the program anyway. But do try and think about if your research is a publishable thing and to go through with that process, because it is quite a long process from the start of a project to actually getting it published. So it's good to have that practice and knowing the process. And in terms of statistics, not all universities teach it very well, especially in med school. But there's quite a few kind of online courses that you can do that teach you statistics, so you know how to interpret them, and it will help you with kind of your assignments as well, where you need to reference papers. You'll know kind of what they mean and what their stats mean, instead of just skimming the abstract and the introduction and discussion, which, you know, sometimes you got to do, but it's good to understand as well what the stats mean. And number 7, get involved. So this is something that I think I did quite a lot in med school, and I'm really glad I did. Part of it was to feel involved and not actually study, but definitely it's, you know, get involved with your med socs, other uni societies that are not med related. There's AMSA, which is the Australia-wide Medical Student Association, and there are some state student councils as well. And, you know, they're just really good opportunities to make friends, to engage in kind of an aspect which you like. You know, some of it could be the more serious things like teaching younger students and mentoring them, or advocating for something you're passionate about. But, you know, also like organize events, do fun projects. Like there's really a variety of different things, and, you know, you get to practice your kind of leadership skills, which again, when you're looking at kind of developing your career later on, is something that training programs look favorably on. They like people who, you know, not just study, but actually engage with their communities and, you know, work well with a team in the clinical and non-clinical aspects. So definitely get involved. I feel like it's part of the uni life to do some sort of student society work, which I would strongly suggest. Although if you're like me, it's also a balance. So if I were to go back and say to myself, I would say focus on the things that, you know, you can make a difference in, and be a bit selective about what you do, and actually also make time for studying and not just doing student societies all the time. And if you're not like me, or and you're kind of, you know, not sure if you should join something, or not sure if you're qualified to join a student society, the answer is just do it anyway. I mean, I feel like the most students don't really know what they're doing, and everyone is kind of just figuring it out as well. So even if you don't have any experience, just apply for something, and eventually you'll end up somewhere where you can do something you're interested in. So just get started, and things will kind of roll from there. Number 8 is learn the life stuff as a student. You know, learn how to meal prep and to organize your schedule, because once you start working, you're really quite time limited. And also, eventually, you'll finally get off the Centrelink life and earn some money. And when you reach that stage, you might have some spare cash to invest, or you know, you want to know how to best organize your money. So Dev Raga's got a series of podcasts. So he's I think, a Melbourne-based doctor who is interested in personal finance literacy for medical professionals. So he does a really good podcast series. And also, especially towards the end of your med school, learn a little bit about taxes and salary packaging and all that stuff, because, you know, you want to save on tax wherever you can, and just look into it a little bit so you know what these things are. And there's also meal and entertainment kind of packages which you can use as a tax saving strategy. And then we've got number 9. So everyone feels kind of like an imposter as a med student. And, you know, part of it is that we as med students would be the just starting in a field where everyone else seems way more impressive, way more experienced, and our knowledge is still, a bit patchy, and we don't really feel like we belong in the hospital environment. Um, and I feel like everyone feels like that. And sometimes you do have to fake it till you make it. In that you wouldn't, you will only feel comfortable in a certain environment after you've been exposed to it many times, and it could be quite overwhelming to put yourself out there. But I think it makes the process easier if you do kind of just force yourself to go to the ward, even if you don't feel like it, and just hang around, and eventually you'll feel used to being on the wards. And another thing I wish I kind of told myself as a med student is that perfect is the enemy of good. So I would sometimes avoid starting projects or avoid doing things because I was worried that I wouldn't do it very well. But honestly, as a student, everyone is learning, and this learning also never stops. So even after you graduate, you'll continue on to learn, whether it's clinically or it's academically in like a subspecialty. Everyone is learning. So, and while you're learning, it's completely fine to not be perfect. In fact, no one ever will be. So just make sure that if you're interested in something, start doing it, and just don't worry about the outcome, and only think about what you can put into it, and where, I guess, the general direction you want to go with, like a project or learning about a topic. So yeah, I think only after you finish something do you look back and you see how different you were when you first started. And it's also important to sometimes reflect and look back and recognize that you have come a long way, because often we finish one phase of our lives and then we kind of move on and then not think about it again, and then constantly feel like you're an imposter entering a new realm. But when you look back, you would kind of realize that you right now is quite different from you like 3 years ago. And I guess that kind of also leads into my next point, which is to take care of yourself, both your mental health and your physical health. I think it's hard to give any specific advice to anyone because each person is different, and you just need to figure out what works for you. But keep up the basics. Try and eat relatively regular meals. Try and get enough sleep and get some form of exercise in. Like for me, I'm not someone who can keep up going to the gym, but I like going to like dance classes because that's what I think is a fun way to exercise. Or, you can just find different activities that are a little bit fun if you're not the gym type, or if you are the gym type, great. And, medical life can be quite hard, and, burnout is sadly very common. And part of it is systemic issues that have been around for a long time, like long work hours, the emotional burden of being in a caring specialty. And some of these systemic issues are gradually being addressed. But oftentimes it does feel like on an organizational level, people keep talking about individual resilience, but not changing the systemic factors. So I guess on one hand, we want to advocate for better working conditions, but on the other hand, to figure out how you can best support yourself. So forming support networks, keeping up with your friends within med and also outside of med, because sometimes they just give you the perspective to keep yourself sane and remind you that your life is not all about med. Find a good GP who can take care of your health, physical and mental. I had a really good one who would always check up on me and ask, how are you going with your learning? Like, and, I think find someone that you feel comfortable about speaking to if you did have any issues as well. And often they're people who have been through the medical training when I say often, I mean all of them, have been through the medical training as well and know what it's like going through medical school and beyond. And keep up things that make you you, like your hobbies or the little things that you do. Really kind of make a difference when you feel like you just have never ending assignments and exams or work that feels like is taking up most of your life. And also there's some good meditation apps out there that are free or are free for medical professionals. So I used to be quite skeptical of things like meditation because I think, in the time I meditate, I could have been doing something more productive. But sometimes it's important, I guess, to clear your mind and really address kind of the way we tend to think. Because as medical professionals, most of us have a type A personality, and we have a particular way of thinking, which is focused on productivity and achievement. And sometimes it's important to take a step back and recognizing that some of those thoughts are helpful and some are not. So I really like 10% Happier, which is kind of, its branding is meditation for skeptics. So it kind of addresses these thoughts that I had and kind of helps you get into a more helpful way of thinking, which in turn actually makes your work more efficient and also your approach to life a little bit more balanced. So those are my 10 things that I think would have been good to know as a med student earlier on. And if you want to keep in touch and listen to more in the student series, you can visit our website. We have an email, sign up to our membership where it's free for students, and we'll put out more of the series where we ask specialists in each area to talk about their experiences. And also you can follow us on Instagram, Facebook, LinkedIn, and we also have a YouTube channel, which you're most likely watching this from. Good to be speaking to you, and I hope you all the best for your med school career.